Thank you. I'm so happy to be here away from the snow and the cold. Good morning. My name is Deanna Santillan, and I am one of the gender advisors at USAID's Office of Population and Reproductive Health in the Global Health Bureau. And it is my pleasure to welcome you to the first lightning session of the day, which is five-minute presentations that focus on the important links between gender-based violence and reproductive health. Preventing and responding to gender-based violence is fundamental to achieving sexual and reproductive health and well-being, increasing our ability to make and act upon informed choices about our sexual and reproductive lives, including whether and when to have sex and whether and when to have children and how many. And gender-based violence is a violation of these rights and of our human dignity. It is defined as violence that is directed at an individual based on his or her biological sex, gender identity, or perceived adherence to social norms about masculinity and femininity, so the conventional understandings of what it means to be a man or what it means to be a woman in a particular place at a particular time. GBV includes physical, sexual, and psychological abuse, threats, coercion, arbitrary deprivation of liberty, and economic deprivation, whether occurring in public or private life. It's manifested in many forms in various contexts. It can occur throughout one's life cycle, and it is often the result of intergenerational cycles of violence. The different forms of GBV are often also closely interrelated. They often affect each other, and they often overlap. Types of GBV include female infanticide, female genital cutting, child sexual abuse and neglect, sex trafficking and forced labor, early and forced marriage, sexual coercion and harassment, intimate partner violence, including marital rape, non-partner sexual violence, domestic violence more broadly, honor killings, rape as a weapon of war, elder abuse, and institutional violence, and sadly the list could go on. Women and girls are most at risk and are the most affected by gender-based violence, so consequently we often hear violence against women and gender-based violence used interchangeably, but it is important to also keep in mind that men and boys can be victims of gender-based violence, as can sexual and gender minorities. So regardless of the target, gender-based violence is rooted in structural inequalities between men and women, and it is characterized by the use and abuse of physical, emotional, financial, and sexual power and control. It is estimated that 1 in 3 women worldwide has been beaten, coerced into sex, or otherwise abused in her lifetime. 1 in 3. Intimate partner violence, both physical and sexual, is the most common form of violence globally. But there's a wide variation across countries in the prevalence of sexual and physical violence experienced by women. For example, focusing on violence perpetrated by a current husband or partner, prevalence ranges from 75% in Bangladesh to 16% in Dominican Republic. Up to 50% of sexual assaults are committed against girls under 16, and up to 30% of girls report that their first sexual experience was forced. There is much we do know and are continuing to learn about the impact of gender-based violence on reproductive health and maternal and child health and other health outcomes. We know that intimate partner violence results in higher rates of unintended pregnancies, unsafe abortions, and adolescent pregnancy. We know that violence during pregnancy is associated with low birth weight of babies. We know that children of abused women have a higher risk of death before reaching age 5. We know that the prevalence of sexually transmitted infections among women who have experienced violence is at least twice as high as in women who have not experienced violence. And we know that HIV infection prevalence rates in particular among women who have experienced violence can range from 4 to 10 times higher in some countries compared to women who have not been abused. But there's still a lot left to learn about the complex relationship between gender-based violence and other health outcomes, and about what are the best ways to prevent and respond to gender-based violence. So in this lightning session, you are going to hear about new evidence on the relations between GBV and unintended pregnancy, including the compounded impact of family violence together with intimate partner violence on unmet need for family planning. And you will also hear about promising interventions to improve gender-based violence screening in family planning counseling and to reduce marital conflict and sexual coercion. And you'll also hear about community-based initiatives to mobilize the creation of violence-free zones. All important pieces of research that move us forward in understanding and addressing the links between gender-based violence and reproductive health. So, without further ado, I'll present the speakers and titles of their presentations for this session. First, we will have Jay Silverman, who is a University of California, San Diego professor and director of research at the university's Center for Gender Equity and Health. And he will be presenting on gender-based violence and reproductive coercion as drivers of unintended pregnancy. Next, we'll have Bianca Morales-Egan, who is from Project Concern International, and she is manager of field operations there. She will be presenting on fostering social action in response to violence against women for HIV prevention in South Africa, a model for change. Next up will be Anita Raj, who is professor here at the university and director of the Center for Gender Equity and Health. And she will be presenting on sexual violence and reproductive control in India. Niranjan Sangurti from Population Council, who is an India associate, will present on the impact of the Rihani Wives intervention on marital conflict and sexual coercion using a cluster randomized controlled trial. And then last but not least, Carrie Jo Clark from the University of Minnesota, who is an assistant professor there, will be presenting on intimate partner violence, other family violence, and unmet need for family planning in Jordan. So I welcome Jay Silverman to the stage. Thank you.